We're going to talk about something today. It's the mental health continuum. I'll try not to bore us, but let's just follow. We're going to be looking at what mental health continuum is. How can you do, mental health, self-assessment for yourself? What tool are you going to use for that assessment? Throughout today, you're going to be hearing a lot about coping strategies, coping mechanisms, how to cope, self-care tips, and all of that. I want you to take note of all of this because this is, one of the things we are going to be getting from this place, how to cope. Identify what you're experiencing and coping with that. So a bit about myself. Okay, I'm Dr. Bright. So I'm a mental health advocate. I see myself as a mental health, I'm a health influencer. Why is it important to even talk about mental health? Why is it crucial? So opening up about your mental health will help you explore how you really feel, improve your relationships, and overcome challenges in every aspect of your life, especially as a parent or a guardian of a special needs child. So people always try to say, okay, what is mental health? What is health generally? WHO defines health as complete physical, mental, and social well-being of an individual, not just the absence of a disease or infirmity. So what is that mental health? What is mental health? How do you say someone has good mental health? So the person is able to, there is psychological wellness, there is emotional wellness, and the person is able to overcome and manage the normal stressors of life. So when you find that lacking, it means there's a challenge in that person's mental. So mental health is not static. It fluctuates over time. Understanding the continuum helps in recognizing the changes in an individual's mental well-being. There is healthy. Remember, it's a spectrum. There is reacting, there is injured, and there is ill. It's okay to feel different ranges of emotion. Sometimes you can be angry, sometimes you're sad. If something happens, you're feeling overwhelmed. That is normal. So for people that have normal mood fluctuations, this can be healthy. So if you're having mood fluctuations, sometimes it's not because there's something wrong. It can be normal. Now, every single person that experiences a chronic physical ailments mostly has mental health challenges as well. So if you're physically well, you're in this healthy. Let's go over to reacting. How do you know a person is in this reacting place? So they can be irritable and impatient, nervous, sadness or feeling overwhelmed. There is displaced sarcasm, in the sense that, you make a joke and they are thinking something else entirely, There's a lot of procrastination as opposed to being in control. They say, I will do this later. So there's forgetfulness as well. Have you ever experienced when you say, I think I forget things easily? It's possible that you're reacting, right? There's muscle tension, there's low energy, decreased socializing. So this could be reacting. So let's go into injured. So how do you identify injured? What do we see? We see anger. We're seeing anxiety, pervasively sad or hopeless. So we're seeing the person sad, feeling hopeless, negative attitude. So there's poor concentration and poor decisions. Restless, disturbed sleep. Sometimes you don't sleep well, but there's always that constant increased fatigue. There's avoidance. The person that usually becomes very interactive, very social, the person withdraws. You know that this person is probably in the injured part of the spectrum. Now, ill. We see angry outbursts and aggression, excessive anxiety, and even panic attacks. The person can become depressed, clinically depressed. There's a lot of negative emotions, suicidal thoughts, and sometimes some people might even have homicidal thoughts, like because they feel that someone else is responsible for their stress, so they begin to have, extremely negative emotions and thoughts. Can't perform duties, can't control behavior, can't concentrate, severe sleep difficulties, difficult to fall asleep. So this is where we also see a lot of substance abuse, because now they have to depend on excessive sleep medications to be able to sleep. And if you look at this part, by, off the top of your head, you can tell where you are. Score yourself. Where are you right now in the mental health continuum? So the tool for actually performing a self-mental health check on yourself is by rating. On a scale of 1 to 10, how do I feel in my emotions? On a scale of 1 to 10, How do I rate my ability to focus? Am I concentrating? On a scale of 1 to 10, am I concentrating? On a scale of 1 to 10, how tired will I score myself? Is there changes in my sleep? On a scale of 1 to 10, am I having good sleep? That is, you rate yourself. How do you scale yourself? How do you score yourself on a scale of 1 to 10?